Hello everyone, welcome to GMS Political Talk. Today I'm going to talk about Chan Chun Seng dialogue with business leaders from the Singapore Chinese Chambers of Commerce. Well, there's a leaked audio of how he replied to one of the questions about the mask. Now I'm not concerned about his use of Singlish. We all use English in our daily lives. There's nothing bad about it. Even though he used very crude words like scolding people idiots, suckers, and wallow, and whatnot, that's not my concern. During his dialogue, his reply, he mentioned two important issues. First, he implicitly admitted that his government has discouraged people from putting up a mask during um, outings if they are not sick, because there's simply not enough masks to go around if everybody is doing that. The second point that he brought out is he took a gamble by using 5 million masks, precious masks, to distribute to Singaporeans, household, 4 each, just to calm the nerves of Singaporeans. I'm going to talk about these two. Now, as we all know, there are two contradictory advisories in the world. One is from the World Health Organization, along with the CDC of America, that says that you only need to put on a mask if you are sick. The other advisory is actually from the Chinese NHC, right? That says very comprehensive. If you are in a very high risk area, like a hospital, clinic, and such, you will have to put on a surgical mask. If you are in crowded places, you have to put on a surgical mask as well, or at least any mask. And you do not need to put on a mask if you are not in a crowded place. It's very comprehensive. Now, which one would we want to believe? Apparently, PAP government conveniently chose to follow WHO. But we have to examine on what basis WHO has come out with such advisory. Does it have the most updated information about the Wuhan virus? Does it have experience in dealing with the Wuhan virus? Does it have anyone at ground zero in Wuhan or China with hands-on experience, asking patients, finding out, fact-finding how they contracted the virus? No. They are 1,000 miles away from the epidemic center. Yet they can come up with an advisory like that. So on what basis do they come up with such advisory? It's based on their experience with flu and SARS, which might not be relevant to Wuhan virus. As we have more information now, and we know Wuhan virus is not like SARS. It spread much faster than SARS. And it's not like flu, because they have a long incubation period. And within this period, 14 days, 24 days, or 46 days, the infected person still can spread the disease. So even though he doesn't have any symptoms at all, unknowingly he will spread the disease if he is not masked. So imagine, I actually do not know whether I'm infected, neither do you, because although we do not have any symptoms, but we might have been infected and the virus might be in incubation in us. And if we walk out to the crowded places without a mask, we will be unknowingly infecting other people, spreading the disease to other people in such places. Thus, I believe this is the basis why the Chinese authorities have such a comprehensive advisory for people to put on a mask when you are going to crowded places. It is very straightforward because they have first-hand experience. 70,000 of clinical data which they extract information, doing studies right on the spot, updating information straight away. Most updated information comes from them, not WHO. So in any logical sense, we should follow the Chinese advisory instead. Because universal masking in crowded places has become a fundamental need, not a want. And of course, Mr. Chan will say that we will not have any enough masks to go around, and our doctors and nurses will run out of masks very soon. Mr. Chan, you cannot change a fundamental need just because you have a logistic problem. That's basically it. And you cannot just compromise public health by giving wrong advice just because you cannot fulfill the supply or the demand of masking. Instead, what needs to be done is to be very, very frank about the situation. We can understand. We can understand it's not the PAP government fault. It's a global situation, a global problem. Everybody, every country does not have enough masks. Having said that, for PAP to blame Singaporeans for being stupid or suckers, to went into frantic panic buying, such and such, and blame social media and all that, it is wrong. Singaporeans lost faith, lost trust and confidence in PAP. Basically because what they say is not what we experience at ground level. They keep saying that there are enough masks to go, enough mask supply, but we can't find any masks for 3 weeks, 4 weeks. Not from the major pharmacies anymore. Right? Of course, Mr. Chan will say he has gambled 5 million masks, precious masks, to give away just to calm the nerves of Singaporeans. But Singaporeans can see through that. They are not stupid. If you have enough masks, you won't be giving only 4 to each household, right? It created more skepticism, more suspicion, and even panic. You try to wayang, but you picture lobang. And that is why, when the Dorscon is raised to orange, everybody panic. If I can't get masks, I don't want to go out. I cannot go out, right? Of course, I must make sure I have enough food. And that's why people panic. And of course, toilet paper. It's partly irrational, it's okay, but it is not because of the social media, which blew it up. Because social media cannot manufacture images of people wiping off the shelves of NTUC supermarkets and all that. It is the PAP government who have created such panic by their mismanagement. Mismanagement by saying we have enough masks, but in actual fact, we do not have enough masks because the ground experience is real. No matter how you try to put it, when people cannot find masks, they cannot find masks. There's not enough. So I would urge Mr. Chan and his government, his party, to revise the advisory. The only way to calm people down is to give them a plan, a workable plan that makes sure they are safe and their health are not compromised. That is the plan. What is the plan then? Should be a bit upfront. Just say it. With the new information that comes out from the front line in China, they have lots of information that comes out, lots of prelim studies that comes out that says that the Wuhan virus is airborne and long incubation period. Therefore, our advisory have to change according to the situation, to the new data and new information findings. Everyone will have to put on a mask if you go to a crowded places, MRTs, public transport, or shopping mall, or clinic, hospital. But we have a problem. We will not have enough masks for everyone because we have to reserve for our doctors and nurses. But we might have alternatives. Teach them how to make contingency masks using waterproof materials, appropriate materials. Teach them how to do it. Or go and find supply of it. Such masks are available in the market, right? Go and buy masks. Having a mask is better than no mask. Right? It's not just about preventing the virus from coming in. It's preventing you spreading a virus unknowingly because you may not have any symptoms. Right? You don't even know that you are infected because there's a lack of symptoms during incubation. So everyone just put on a mask. Not necessarily a surgical mask, because surgical masks we have to reserve for our healthcare workers at the front line. Then people can understand. People will not blame PAP government for not having enough masks because there's a fact that there's a problem that everybody is facing in the world. But provide an alternative that will not compromise their health, their safety. I hope, Mr. Chan, you are listening. Thank you.